Hi everyone, I'm Donna Hamilton. Say Baltimore and what springs to mind? Crab cakes, Cal Ripken, Fort McHenry, but don't forget Mercy Medical Center. Mercy anchors Baltimore's downtown business district and is known for delivering academic hospital caliber care in a community setting. Investing in a Gallup study and dispatching a team to visit women's centers all across the country, Mercy has become one of the first hospitals in the United States to focus its mission on the care of women. At the tender age of 10, young David Riseberg knew he wanted to become a doctor, and he did, becoming chief of medical oncology and hematology at Mercy, known for his work in the research and treatment of breast cancer, as well as blood disorders like leukemia and lymphoma. For him, medicine means a way to help people, and in doing so, creating long-standing relationships which have taught him a great deal about life. Seeing women face difficult diagnoses with courage and strength, Dr. Riseberg says he has learned not to sweat the small stuff. For you personally, what are you most proud about, what you've been able to accomplish here?
Yeah, I just take a lot of pride in being able to care for these women for so many years, because I've been here for 24 years.
Right, that's a long time.
It is a long time, and I first met them in a very difficult situation, and,
Sure.
and now I've seen them through it. And for women who are 20 years out, you feel like you're part of the family.
You probably are.
Yeah, and you've seen them, the little kids grow up, and seen mothers become grandmothers, and
Yeah.
it's really nice to see women back just once a year who have been part of my professional life for so many years. I came from the National Cancer Institute for my training, and we have a lot of clinical trials, particularly in breast cancer, but in other cancers as well.
Right.
And we have women who come from hours away specifically for a study, and we've had patients referred to us from Hopkins.
Wow.
To be able to offer cutting-edge research and to be able to help move the disease forward, because if women don't participate in research, we're not going to be able to learn, and we're not going to be able to develop new treatments and hopefully cures.
In cancer treatment, how would you describe the changes in 24 years?
Oh, it's really been quite dramatic.
That's huge.
I mean, there were really only chemotherapy options, and they were more limited, and over the years we've gotten better chemotherapy, better supportive care, so the side effects, while still significant, aren't as bad as they once were. And now we also have the immunotherapy drugs, which help to allow our body's immune system to help fight off the cancer. So it's really an exciting time.
You are not from a family of doctors.
No. My grandfather was a dentist, and so he was always talking to me about that. And I wanted to be a doctor since I was 10.
Really?
So
You never changed your mind. It was
No,
always.
I don't know. I guess I was interested in science.
Right.
I was interested in helping people, and I was pre-med from the get-go. I remember my grandfather, when I was a first-year medical student, he was very proud of me, and he came up and wanted to visit the cadaver lab. And so I took
Who
him.
wouldn't, right?
Absolutely, it's a great tourist spot. And my daughter is interested in public health and is actually doing research in breast cancer this summer. So
nice.
it's exciting to perhaps pass this on to the next generation.
Was it anything in particular that made you interested in treating women?
During my fellowship at the NCI, I became interested in breast cancer, and I just found that the relationships that you develop were strong. It's a disease that we have good treatment options for, and so I felt like I was able to accomplish something, and it was also an area of great need. It's a very common cancer.
Yeah. I was showed this book that's by one of your patients?
So actually it's by the daughters of one of my patients. So this woman, Dawn, had breast cancer, and she was looking for a book to read to her, at that time, middle school age daughters, about going through cancer treatment. She found that all the books really were more about death and dying, and so these two girls wrote a book as part of a school project, and then they actually had it published. They actually went on the Rosie O'Donnell show, and she actually assisted them in getting it published.
Yeah, our mom has cancer.
And I pass it out to
Other
young
patients,
mothers.
right.
And they really, it is very special to me, certainly, because she,
It's a great idea.
her
Love it.
daughters wrote it. It's one of those things that I'll always remember.
What do you think are the biggest challenges ahead, for you as an oncologist for Mercy Medical Center?
I feel like these cancers, unfortunately, are smart and they know how to become resistant. So I think as a physician, I don't want to make decisions on the basis of someone's insurance.
Of course.
And nor do I want to make a decision saying, well, maybe this is too expensive, we shouldn't really offer it in this situation in general. I like to offer what's best for my patients, and then we try to figure it out financially, and usually we do.
Right.
We have good financial counselors, and there are other support systems in place so that in general we're able to offer the treatment that we want.
These have been, I guess these must have been very happy years for you here. You're still
Well,
here.
I think that's the thing about Mercy, is that you look around and most of the key players have stayed. I think, well, I wake up every morning and I enjoy going to work.
Right.
I take pride in the fact that I've been able to stay here, and I think if you look around this building, there's a lot of other doctors like that, and I think that really speaks to the commitment that the hospital has had to have a good relationship between the physicians and administration. What we've tried to have here is an institution that has a community neighborhood feel, but with cutting edge academic type treatment. When you see women dealing with a lot of difficult situations, sometimes you go home and the little things don't really bother me as much. So I think I've taken perspective from what I see and taken that home, and I don't sweat the details.
Few in medicine today would argue the importance of women's health care, but that was not always the case. Mercy Medical Center was one of the first hospitals in the nation to recognize the need for a program dedicated to women's health. Armed with a vision, Mercy doctors and administrators joined with the Sisters of Mercy to create a center specifically designed for the diagnosis and treatment of women's disease, from breast and ovarian cancer to all manner of GYN conditions. Today, the Weinberg Center for Women's Health and Medicine at Mercy is recognized as among the best, providing quality care in a compassionate setting. I hope you've enjoyed this opportunity to become better acquainted with Mercy and its mission of caring, as seen in the physicians who have made this mission their own.